Mouth care. Mouth care is an act of cleaning the teeth and gums and tongue and throat for the food particle, plaques, and bacteria. So the purpose of the mouth care is to prevent and control plaques associated oral disease. So the equipment of the mouth care is soap, bristle, toothbrush, toothpaste, dental floss, and the mouthwash, clean gloves, glass of water with water, then emission basin, face towel, and the paper towel. That's all, ma'am. Thank you. So today I'm going to do the assessment of the mouth care. So first is explain the procedure to the client so the client can understand and cooperate and participate during the procedure. So good morning, ma'am. I am Rhona and I'll be your student nurse for today. So now I'm going to do the assessment of the mouth care. So is that okay with you, ma'am? Sure. And next is wash your hand. Don't disposable glove if assisting oral care. So as if magamit ko anang gloves because glove can reduce the risk of transmission during the procedure. And the next is assemble equipment in the overbed table within the client reach so that we can promote the workflow and for the client comfort. Then the next is provide privacy by closing the window and the door, and to respect the client dignity and to provide client comfort. And the next is lower side rails and assist the client to sitting position if permitted, or turn the client into side. Then place a towel across the client's chest. Raise the bed as a comfortable working position. So, mom, can you stand up, mom? Can you sit on the bed, mom? This is this is to ensure that the client remain clean until the procedure. The next is encourage the patient to brush own teeth or assist if necessary. So, mom, would you like me to brush your teeth, or I am the one who brush your teeth?
You can brush my teeth.
I can brush your teeth. Okay, thank you. This moisture toothbrush and apply toothpaste to the bristles. Next is place the brush at a 45-degree angle to the gum line and brush from the gum line to the crown of each row. 45 degree. This is to ensure that all the area is clean with the toothbrush. And the next is brush tongue. I brush tongue gently with toothbrush. And next is have the client rinse vigorously with water and spit into the emission basin. Then repeat until clear. And the next is assist the client to floss each teeth if the client prefers. So, mom, would you like to floss your teeth?
No.
This is to prevent the gum disease. And the next is offer mouthwash if the client prefers. So, mom, would you like to have a mouthwash?
No. Thank you.
So to it is to it is to have the teeth clean and fresh. Then the next is assist wiping the client mouth for the client comfort. And then before we do the next procedure, we have to ask the client if the client is wearing a denture. So, ma'am, do you wear any dentures?
No.
So, if the client wear dentures, assist client with removal and cleansing of denture, assist if necessary. And first thing we do in removing the denture is apply a gentle pressure with a 4x4 gauze, 4x4 gauze, 4x4 gauze to grasp the upper denture plate, remove and place it immediately on in the denture cup. It is to protect the dentures and to avoid the dentures to be broken. Then the next is, if the client prefers, add a denture cleanser on the cup with water and follow direction on procedure procedure or brush all areas thoroughly with a toothbrush and toothpaste. Then place a paper paper towel or washcloth in the sink while the client is brushing. The next is wash thoroughly with water and return denture to the client to provide a clean and oral hygiene. Then the next is, for the client that have dentures, we have to offer a mouthwash so that the client can rinse his or her mouth before placing the denture. It is to ensure that the mouth is clean and the denture is clean before placing it together. Then the next is move equipment and position the client to comfort and record any unusual bleeding or inflammation and raise the side rails and lower the bed. So the next is wipe off over the bedpan and clean equipment use and remove disposable glove inside out. Dispose it properly and wash your hand to maintain cleanliness and hygiene standard by cleaning and sanitizing the equipment. The next is document all assessment and include any problem such as an irritant area on the mucous membrane. Record observation of any issue encountered during the procedure to facilitate communication to the health care team provider or member to ensure continually care and monitor the client oral health. And that's all, ma'am. Thank you.